All right, you've made it to the review sessions. This is the first of 2 review sessions. The second one will look at poses and really kind of pulling that all into the practice. But first, we're going to look at a recap of everything we've learned. So I'm going to go through and I'll pause as we go. Have your finger on the button ready to pause the video because it's really helpful for you to stop and consider and really think of the answer yourself. And then turn it back on so you can hear the right answer to see if you're on track. So I'll pause and leave a little space as I ask you some of the questions as we go. Let's start with bones. And I'm going to kind of jump around a little bit here to keep you on your toes. But we'll start off with the bones to begin. Build a little confidence here. Right? What do we got here? Clavicle. What have we got here? Humerus. What do we have here? Femur. What bony prominence do we have here? Iliac crest. What bony prominence or articulation do we have running here, up and down? What do we call this? The bicipital groove. And hopefully you remember from the name what runs through that groove. The bicep tendon, the long head in particular. What do we call this bony prominence here? The acromion. And which bone is it part of? The scapula. What do we call the 2 parts of the intervertebral disc? Remember, we've got an outer layer and an inner layer. The outer layer, we have the annulus fibrosus. Remember that stronger outer layer that helps to contain the inner filling. And the inner layer is the nucleus. That more kind of liquid layer, that fluid layer that allows us to absorb shock as well as to be able to be flexible in the spaces between the spine. Remember, the other function of the disc is actually just to provide some space in between the vertebrae to allow for the bones to move on top of and between each other. Remember the curves of the spine. What do we call the curvature of the cervical spine? Remember, we've got a lordosis here. What's the other part of the spine that has a lordosis? We got the lumbar spine here. Then what do we call the curve of the thoracic spine? We have kyphosis, and we also see that in the tilting of the sacrum, the kyphosis of the sacrum as well. What was the main type of joint that we talked about? Remember, the main type of joint we talked about was the synovial joint. We mentioned this as the most mobile joint, and really the type of joint that most of the mobile joints of the body are going to be included in. The shoulder, the hip, even things like the AC joint here, the knee. The synovial joint features, remember the most important feature of the synovial joint is implied in its name. We have the capsule that secretes the synovial fluid. And maybe you remember why that synovial fluid is so important. Remember, the synovial fluid lubricates the joint, but then again, why is that lubrication so important to the joint? Remember that lubrication, like an oil can, decreases the friction to help decrease wear and tear on the joint. It helps the bones to be able to translate past each other, over each other, with less friction and less wear and tear on them. Let's look at the layers of the joint, the synovial joints again. So remember, the first layer of the synovial joint is simply the bones themselves. And we looked at different bones and how different bony articulations set us up, predispose us towards or away from stability and mobility. The shoulder in particular, we had this predisposition toward, more toward, is it stability or mobility? Right? Mobility versus the hip in comparison to shoulder, which is more predisposed toward stability. However, we still get a lot of mobility in the hip. So the first layer is the bony structure, which creates some level of stability depending on how the bony structures articulate. Then on top of the bones, what's the next layer we see? The next layer we talked about was the articular cartilage, the hyaline cartilage, covering the ends of the bones, the articulating surfaces that rub against each other here. And then we talked about a second kind of cartilage that was a little bit different in different joints. In the shoulder and the hip, we called this fibrocartilage the labrum, that little lip surrounding the joint. And in the knee, we talked about this as the meniscus. And these help to allow the bones to connect to each other more closely. They help to kind of fill in some of those gaps, the lip around the glenoid fossa and around the acetabulum, to create a much better connection between the bones, and also to seal in the fluid and create a little bit more stability there. So that lip allows it to be more encapsulated to help stabilize the joint, to decrease wear and tear. So bone, cartilage. Then what's next? What's the next layer we talked about on top of the cartilage? Remember, next we've got the capsule, the joint capsule, which is encapsulating the joint here, or surrounding the joint, the inner layer of which was made of what? Remember, the inner layer of the capsule is the synovial membrane, which secretes the synovial fluid, again, to lubricate the joint. Then the next layer on top of that, we've got bone, we've got cartilage, we've got capsule. Then outside of the capsule we have, remember, the ligaments that reinforce the capsule and really connect bone to bone. Then the last layer on top of that, we have muscles and tendons, right? That superficial layer that is within our conscious control, that are kind of actively coordinated or influenced by how we move and articulate the body with the muscles. So, what about, what's this bony prominence called? The spine of the scapula. Now let's start to add on some muscles with that. What muscle originates here? What's this muscle here? The majority of the back of the scapula. Infraspinatus. What's the antagonist to infraspinatus? Remember, the antagonist, infraspinatus, is going to create external rotation. So the antagonist is going to be subscapularis, the mirror image of it on the front of the scapula. Both of which are part of what group of muscles? Remember, infraspinatus and subscapularis create the front and back of the rotator cuff. What's the primary function of the rotator cuff? Remember, the primary function of the rotator cuff, since it sits high on the humeral head here, is to help position and stabilize the head of the humerus in the socket. What's this bony prominence here? The ASIS. Remember, we had a couple muscles attaching around the ASIS. Maybe you can remember one of them. There were two in particular we looked at close by here. One of them we had was the TFL, going from that ASIS to the IT band. The second one we had just below the ASIS, the rectus femoris, going straight down to connect with the rest of the quadriceps. What is this bony prominence called here, sticking off the sides of the vertebra? We call these the transverse processes. And maybe you remember the three weight-bearing points of the vertebra. Remember, for each segment, we've got three weight-bearing points, two of which will be the facet joints in the back, and the third one will be the bodies or the discs on the front. What's the name of this bony prominence here? So those bony knobs right on the sides of the sacrum. Remember, we call those the PSIS, posterior superior iliac spine. Just medial to the PSIS, what joint do we have here? Remember, we have the sacroiliac joint, the SI joint. What do we call this bony prominence? The ischial tuberosity. And maybe you remember some of the attachments to the ischial tuberosity. We had several different muscles that attached here. Probably the first thing you think of are the hamstrings, right? We've got all of the hamstrings, all three of them at least, both the semimembranosus and the tendinosus attaching, as well as the long head of the biceps femoris. And then we talked about one other one of the adductors that attaches back on the ischial tuberosity as well. So the adductor, and then 3 of the hamstrings there. Semimembranosus, tendinosus, and bicep femoris, the long head. Now, that brings us to a good question where you can kind of start to apply some of this information. If you have someone who has pain on the ischial tuberosity here, and they feel it mostly in Upavishta Konasana, or let's say Prasarita Padottanasana, a wide leg forward fold, more than legs together, and more than Baddha Konasana with the knees bent. Which of those attachments to the ischial tuberosity do you think is the primary concern or irritation? Is it the semimembranosus and tendinosus? Is it the biceps femoris? Or is it the adductors? And based on the information we talked about before, remember, semimembranosus and tendinosus are going to be stretching the most with the legs spread wide with the knees straight. Remember, the adductors, especially the one that connects to the ischial tuberosity, does not cross the knee. So I'll be feeling that even more so as I bend the knee and take the hamstrings out of the picture. And if I were to bring the legs together, I'd be feeling more of the biceps femoris. So wide leg forward folds, and usually people who have hamstring irritation have one of those scenarios that's the most uncomfortable. Sometimes if it's really bad, it might be a few of those or several of those. But for the most part, most people will have one area that it's predominant. And that's because we have several different muscles that attach here that can become irritated. So, what about, maybe you can consider and remember the scapular stabilizers, the main muscles we looked at to stabilize the scapula here. We talked about 2. One was serratus anterior, and the other one was the rhomboids. Now, what muscle did we have that was a large muscle here attaching all through this lower thoracic and lumbar, catching onto the pelvis, the scapula, a little bit on the ribs, this large muscle coming to insert on the front of the humerus? Remember, that was going to be, that one's the lats. What muscle do we have here? This one we know really well, right? Trapezius. What muscle do we have here? Going more up and down to the greater trochanter. Gluteus medius and minimus. What muscle do we have in this pocket zone here? Tensor fasciae lata. What muscle do we have here? The delts. What about here? Pec major. What about here? Right in this little area deep. Pec minor. We know this one. Biceps. What muscle do we have that's going to run from the lateral border of the sacrum back to the greater trochanter, the back part? What muscle specifically? Remember, we saw the whole external rotator group in the back here. One in particular, remember the piriformis, going from the lateral sacrum to the greater trochanter. And then what other feature did we have nearby that was a potential obstacle running right underneath the piriformis in most circumstances? Remember, we have the sciatic nerve. What muscle do we have running in between the lumbar spine and the rib cage and the pelvis in this area here? Here and here. We've got the quadratus lumborum, our primary lateral stabilizer and lateral flexor here. What was the name of the group of muscles that run along the sides of the spine, these ropey pillars here? Remember the erector spinae. What was the name of the abdominal muscle that helps to draw the contents of the belly in closer toward the spine? The cinching in action here. Remember the transverse abdominis. Do you remember the name of the X shape here of musculature in the abdomen? The obliques. So remember we had this one here, rectus abdominis, obliques diagonally, and transverse abdominis horizontally wrapping around. Now, maybe you can remember some of the shoulder flexors that we talked about. Remember, we talked about 3 of them in particular. One of them, the pec major. Another one, the anterior delts. And another one, a little bit with the long head of the bicep. And then maybe you can remember the abductors of the arm that we talked about. Remember the first one we mentioned was this supraspinatus, abducting a little bit here. And then this primary abductor here of the lateral deltoid. What other muscle did we talk about that's really important and helpful for abducting the arm up all the way? If we want to get past this kind of 90-degree angle here, what muscle do I need to kick in to help me lift the arm up all the way? And remember, the key to this is that it's not just the humerus moving, but unlike Fred here, I have to move the scapula into upward rotation. And to do that, I need a little help from the upper traps. Maybe you remember the main action as well of the lower traps. Remember, the upper traps are also going to elevate and upwardly rotate the scapula. And the lower traps will depress and also bring the scapula back down into downward rotation. So as I lower my arm down to my side. The middle traps function like what muscle? Remember, the middle traps are going to function just like the rhomboids. So we've got that retraction action of the middle traps and the rhomboids. What's the antagonist to the rhomboids and the middle traps? Remember, serratus anterior will protract and draw the shoulder blades apart here in opposition to the rhomboids. Now, what's the antagonist to the erector spinae muscles? So remember, the primary function of the erector spinae muscles are to extend the spine and hold us upright. So the primary antagonist here we're going to have is going to be the rectus abdominis. Now, what's a synergist that works with the extensor muscles here, the erector muscles? Remember, we talked about the iliopsoas, or the psoas specifically, extending the lumbar spine or creating this lordosis. So the erector spinae muscles and the psoas here will work antagonistically with the abdominals, specifically rectus abdominis, but also the obliques. Remember, create some of that flexion. So the abdominals and the erector spinae muscles work in opposition to each other to help to juggle our upright posture. Now, looking at the iliopsoas, what's the other function of the iliopsoas? We talked about it as creating that lordosis, or pulling the lumbar spine forward into extension. The other main function we talked about of the iliopsoas, remember, was also hip flexion. So what's the antagonist to that hip flexion capacity of iliopsoas? What's the main antagonist? Remember, the main one is going to be gluteus maximus. And the synergist with that will be the hamstrings. Now, what's the antagonist to the hamstrings' main function, remember, of flexing the knee? Remember, the assistant function, the other function is going to be to extend the hip a little bit, but the main function of the hamstrings is going to be to extend or to flex the knee. So the antagonist to that, remember, we have quadriceps and rectus femoris. Now, which of these muscles did we talk about as a primary stabilizer of the pelvis? Anytime we're standing on one leg. So when we lift one leg up, this muscle helps to keep the pelvis level from doing this to doing this. any one-legged poses. And remember, primarily that's going to be gluteus medius here. It's really important pelvic stabilizer. Which muscles did we look at that attach to the IT band? Remember, the IT band is this connective tissue without a contractile portion like a muscle would be. There's just fibrous connective tissue spanning from the iliac crest all the way down past the knee. We have two muscles that connect to it directly, one in the back, one on the front. Gluteus maximus on the back, tensor fasciae lata on the front. Then we talked about some other muscles down here, the lateral quadriceps, which can also, they don't attach to it directly, but can also influence that IT band when the IT band has to rub over it and they kind of adhere to each other. Which muscles did we talk about that cross the knee? Remember, we mentioned the hamstrings crossing the knee, the quadriceps crossing the knee, one of the adductors, the gracilis, crossing the knee. We also mentioned that one calf muscle also crosses the knee. Remember, the gastrocnemius also crosses the knee. Which muscle did we talk about being the primary muscle responsible when we have winging of the scapula? So we talked about one muscle primarily drawing the scapula onto the rib cage there to prevent that winging. And that was serratus anterior. Which of the muscles that we looked at here is not movement dependent? We talked about a couple of them, actually. We talked about one primarily in the core that we can activate that's not dependent on movement. It doesn't create a strong movement. And that was transverse abdominis. We also mentioned some others that we could probably put in this category as well, like the diaphragm. Clearly, we want that one not to be dependent on movement because we need to be able to breathe all the time. And some of these smaller stabilizing muscles like pec minor and some of the supportive muscles as well. Which muscle can be problematic for the sciatic nerve? Remember, the main muscle we looked at is the piriformis that overlies the sciatic nerve. Which muscle is our primary muscle of respiration? Remember the diaphragm here, sitting like a parachute inside of the rib cage. Is it contracting or lengthening as we inhale? Is the diaphragm contracting and shortening or lengthening as we take an inhalation? Remember, the diaphragm is contracting and pulling down to draw the air in as we inhale, and then relaxing and lengthening back up as we exhale and allow the diaphragm to relax. Which muscle primarily is going to be stretching on the lower arm of Gomukhasana? So for this one, think of what's happening here. I've got internal rotation of my arm as I take the arm behind the back here. So if I think about the rotational capacity here, I want to think the opposite. So what muscle is my external rotator? Because I'm going to be stretching at an internal rotation. So one of the primary muscles being stretched here, the main one we're looking at is infraspinatus. My external rotator is shortening to create external rotation and stretching as I take it into internal rotation. What muscle specifically or group of muscles am I targeting in Baddha Konasana? We've got a couple here. So think about what's happening. I'm taking the knees out away from the midline, right? So I'm abducting the legs, but I'm also externally rotating and folding forward here. So I've got two possible scenarios. One is the one we feel right away, and sometimes it's helpful just to think of what you feel, right? The adductors are being stretched here as I take the knees apart. And then as I externally rotate and fold forward, remember this was the one exception that I'm going to be stretching the external rotators as I externally rotate. So the piriformis and the external rotator group is stretching, as well as the inner thigh muscles. What about this? What about when I take the legs together? What am I primarily stretching in the hips? Knowing that I have two things happening. One is a little bit of external rotation, but more importantly, this adduction, drawing the knees in. Remember, primarily I'm going to be targeting the abductors, so gluteus medius, all the way down that IT band potentially maybe, and maybe a little bit in piriformis and the external rotators. Now here's another one for you to consider. What muscles get tight? What muscles in particular get tight when I'm sitting for long periods? No one does that, right? So when I'm sitting for long periods, there's several muscles to look at. One of the first ones that we talked about was the iliopsoas. Remember, our hip flexor shortening passively here and getting tight. We mentioned that, that difficulty kind of standing upright again, that tension in the lower back from that tightness in the iliopsoas. What else is shortening here? We've got the hamstrings that are getting tight and short here, maybe even the calves a little bit. And then think about what's getting short here now, right? The pecs, maybe even the lats a little bit as the shoulder rounds forward, maybe even the abdominals, though a lot of this is a little more passive. So there's several different things that are happening there, and then the traps getting tight as well. So if we were to look at targeting areas of tension for computer sitters or desk sitters, we could look at any of those. And clearly some other areas too. What was the muscle that we looked at to create this idea I mentioned of this three-dimensional, I talked about this idea of a three-dimensional Uddiyana Bandha. Rather than just belly up and back, this idea of Uddiyana Bandha three-dimensionally wrapping around and cinching in the waist. Remember, that was transverse abdominis. Now, we talked about the abductors as drawing the hip into the socket, as being that primary hip stabilizer. But what other muscle group works with the abductors to help position the head of the femur in the socket? Remember, that was the adductors, them working together to juggle the positioning of the head of the femur. So back to the arm, what's one of the obstacles that we find with the triceps? Remember, the tricky part of the tricep was this intermingling of the triceps and the lats and the infraspinatus all running over each other in different directions, and that kind of tangling of the tissues to restrict this overhead motion when it gets really tight here. What about the obstacles with the bicep? Remember, the obstacle with the bicep was this flossing through the bicipital groove, which can become irritated with a lot of repetitive motions, or that tension on the bicep tendon that can pull on the labrum in things like chaturanga, or when I'm laying into the shoulder, even just potentially posturally as well. So what is this group of muscles we talked about here? The thin skin side. Remember, we talked about these as the flexors, and this side being the extensors. In the leg, this side we had as the extensors, so similar to this side, and this back side being the flexors. What muscle did we talk about specifically to externally rotate the hip? Piriformis. What about externally rotate the shoulder? The humerus. Infraspinatus. What about our main hip flexor? Iliopsoas. What about the synergist to the iliopsoas? Rectus femoris, tensor fasciae lata. What's the other function of the TFL? So we talk about it for hip flexion. Remember, we also have it for abduction and the only one we talked about for internal rotation. What muscle internally rotates the humerus? The subscapularis. And how do we palpate the subscapularis? Remember, this is the one we looked at in the armpit. What muscle runs right above the spine of the scapula here, deep to the trapezius? Supraspinatus. What's the X shape? Obliques. What do we have that peeks out the sides of the erector spinae muscles here on the sides of the spine? Remember the QL. What do we have superficially here? The backside. Glute max. Right down the center of the quadriceps. Rectus femoris. What's this superficial muscle here? Gastrocnemius. The medial part of the hamstrings. Semimembranosus and tendinosus. What about here? Triceps. What about here? The deltoid. Remember the function of the front of the deltoid, the anterior deltoid. Flexion. The mirror image on the back, extension. The function of the lateral deltoid, abduction. Now, what's the antagonist to the lateral deltoid there? The primary one we talked about, remember, was the pecs. What's this flap of tissue here in the back of the armpit, primarily? Remember, this is the lats. And what's this one here? The pecs. And then on the sides of the ribs here, we have serratus anterior. What do we have between the shoulder blades here? We have a few things, right? We have rhomboids. What else do we have? We've got middle traps. And then running up and down, we've got the erector spinae muscles. What muscle do we have? What muscle group do we have running right here? The adductors. And the pretty one running right down the center. The six-pack abs, remember the rectus abdominis. Wrapping around. Remember, we palpate this one inside of the ASIS. When you cough or sneeze, transverse abdominis. Which muscle am I palpating as I grab this kind of cable, this tendon, in the lateral part of the knee? The biceps femoris, remember the lateral hamstrings. Now, if I go just behind that, what other muscular attachment am I going to have proximal to that? Remember the gastrocnemius crossing the knee and crossing over the hamstring tendons. If I palpate just below the iliac crest, somewhat lateral here, what muscle group am I going to be on? What two muscles? Remember gluteus medius and gluteus minimus. What am I on here? TFL. What about right in the bullseye here? We did the palpation with the myofascial balls, and we took one ankle to the knee. Remember, we were targeting right in the bullseye there, the piriformis. What's the area that tends to go weak here that overlies the sitting bone? Remember the lower part of gluteus maximus versus the upper part, which attaches to the sacrum, which tends to clench and compress the sacrum, SI, and lower back. Which muscle do we have if we were to palpate medial to the ASIS and we cough? We have the transverse abdominis, the TVA, we mentioned already. But if I hook my fingers around and press back toward the pelvic bone here, in fact, we did this one palpating and then lifting a leg. What muscle am I palpating back here on the actual bone? Remember, iliacus. But I'm also palpating through transverse abdominis and the internal obliques. What muscle am I palpating as I come just below the ribs here and start to contract or flex the spine in my crunches. Right, I've got the upper part of rectus abdominis. What am I palpating here as I come right off of the coracoid process, deep to the pec major? I have pec minor. And what else comes off of this coracoid process? So pec minor goes to the ribs, and then we have the short head of the bicep coming down the arm. And then if I palpate here on the chest, all through this area of the chest, remember, I'll be palpating on that large muscle of pec major. So, replay that as many times as you need to. We've covered a lot of the information that we went over. The next video you're going to see is putting this into the practice, and we'll look at how that shows up even more now in the poses to help you integrate that information in a way that's really relevant to teaching yoga.